viewers, we are in the eye clinic today. That is Magna Eye Clinic here in Abuja to discuss a very exciting topic, very important topic because so many people have been having vision loss not knowing the cause of it. Today we are going to discuss on the topic glaucoma. And with me I have an optometrist who will be telling us what glaucoma means. But before then, if you want to be part of the show as usual, you can follow us on all our social media handles on official Rabbit TV. And you can keep watching us on Rabbit TV channel 176. So sit back and relax. Don't go nowhere. We'll be right back. Alright, welcome back. We have an optometrist, as I said earlier on, and she is Mrs. Emilia Ihizie, and she'll be telling us about what glaucoma means and how it could be managed. Mrs. Emilia, it's a pleasure to have you on this program, Health 247.
Thank you.
All right, can you tell our viewers what glaucoma means and how it could be managed?
Okay, so glaucoma is a vast topic, but we're going to make it as simple as possible. So glaucoma is an eye disease, it's a group of eye disease that damages the nerves of the eye. We have the nerves in the nose, it's called the olfactory nerves. We have the nerves of the ear, the auditory nerve, and then we have the nerves of the eye. It's called the optic nerve. So I'm going to be using the word optic nerve because that's what the nerves of the eye is called. And that's what glaucoma actually damages.
Okay.
So when the nerves of the eyes start getting damaged, that is when you call it glaucoma. When it starts happening, the person will no longer be able to see because the nerves are meant to transmit information from the outside world to the back of the eye, that's to the brain. So just to make the person know that, okay, look at what you're seeing, look at the information of what you're saying. So if those nerves, that's the transmission, if they're getting damaged, so that's basically blindness. So glaucoma is any kind of thing that will cause damage to the nerves of the eye. And what actually causes this damage is when the nerves are not getting their required nutrients. Anything that will make the nerves not to get their required nutrients, they start getting damaged. And when they start getting damaged below their functional activities, then we can now say the person has glaucoma.
Wow.
So yeah, so that's basically what glaucoma is damage to the nerves of the eye.
Okay, what could be the cause of glaucoma? Because there are some people that they don't even know that they have glaucoma until it has gone to the stage where it's beyond repair. So what could lead to the cause? What could lead to the cause of glaucoma?
Okay, so there are a lot of causes of glaucoma.
Okay.
A lot. But the commonest cause is what we call ocular hypertension. That's high pressure inside the eye.
Wow.
You know, when we have high pressure for the body, that one is blood pressure, right?
Sure, sure.
Now, there's also high pressure for the eye, which is called ocular hypertension. Ocular is eye.
Okay.
Ocular, anything ocular is eye. So when there's a watery fluid that is being produced inside the eye, the inner chambers of the eye. So I wouldn't want to go into naming, but let's just call it a watery fluid.
Okay.
So when this fluid is being produced, the purpose of the production of this fluid is to provide nutrients to the inner chambers of the eye, to take out byproducts about that, just to keep that balance in the eye. So the formation of this fluid and the outflow of this fluid has an equilibrium.
Okay.
So when they are going in, when they are done, they should go out. So that the ones that want to be produced will not meet the one that was already been there.
Okay.
So that equilibrium needs to be maintained. If it's not maintained, maybe if the drainage system, which the fluid using flowing out, if it's faulty or if it's blocked, the fluid will not be able to flow out again.
Okay.
And then more fluid will be coming in, which will now result to retention of fluid. It's just like your tap sink at home.
Yes.
When it's clogged, and
It gets blocked.
it gets blocked, and you keep opening the tap for water to rush in. You see that retention of fluid. The same thing can happen in our eye, and when this happens, it raises the pressure in the eye. And when the pressure in the eye is raised, it starts blocking transportation of nutrients. Just imagine you a caterpillar climbing your hand and remaining there. You know that the blood
pressure.
There's a pressure there, and it's pressing on the transportation of nutrients to that part of your hand. You know what will happen to your hand if it stays there for like 2 days or 3 days? Exactly. So that's exactly what is happening in our eye. If the pressure is too high, it presses on the pipes or the vessels that is providing nutrients to the optic nerves. That's the nerve of the eye, and it starts getting damaged. So that's what causes glaucoma. It's just one of the causes. It's not the only cause. So it's just one of the causes, and that's the commonest cause of glaucoma. There are other causes, genetic factors, and there are a lot of big names I wouldn't want to mention. So, but basically, anything that will block transportation to the optic nerves will cause glaucoma.
We are talking about what could lead to glaucoma, but at this point in time, there are some people that develop glaucoma and they are not even aware of it. So, what are the symptoms of glaucoma? At least let people know when they have glaucoma to go see the doctor before it gets to a level that cannot be fixed.
All right, the symptoms of glaucoma. Glaucoma actually, unfortunately, it doesn't have any symptom. People that have glaucoma, especially at the early stage, there's early stage, there's advanced stage, and there's late stage. At the early stage, it's actually difficult to know. One that has glaucoma that is at its early stage would not know, because there are no signs. There's no headache, there's nothing, there's no pain. Just like that, the person will be getting blind and they won't know. And the reason there is no symptom is because of where the damage takes place at. Let's imagine this circle as your field of view, where your nerves are arranged for you to see. So in the circle, we have the peripheral edges on the circle, and we have the central point. Now, the glaucoma damage starts from the peripheral edges. You understand? Now, if I'm looking at you directly, I'm using my central point to look at you. And any other thing that is at my side, I'm using my peripheral view to see it. Now, this is the one that will notice if there's any damage at the central point of my nerves. If there's any damage, I will notice it, because then I'm looking at you, I'm not seeing you. But if there's anyone at the peripheral edges, I wouldn't know, because I actually don't use that all the time. So there are no symptoms for early stages. But there are some lucky people. Yes, some lucky people, they will actually feel symptoms, especially the ones that their drainage system will get closed. There's something we call angle closure glaucoma. Like I said, when the watery fluid, when they are done with their job, they flow out. Yes, there's a drainage faculty, there's a system that they use in flowing out. Sometimes that system can be closed. When it's closed, it can give that person headache, because there will not be like a very sharp rise of pressure, which that eye can no longer take. So the person will start feeling headache and pain and all that. So they will come to us, and they will say that, oh, this person is having angle closure. And normally angle closure can cause glaucoma quickly. So those are for the lucky ones. And secondly, when the pressure is when there's raised pressure in the eye, consistent pressure, sometimes it can actually affect people's reading at near. Especially with people that have reached, there's something we call presbyopia. Presbyopia are people that their lens, there's a tissue in our eyes called the lens. When you start losing that elasticity, you won't be able to read properly at near. So there's a muscle that actually contributes to the role of people using their lens to see very well at near. Now, if there's pressure in that eye, the pressure will start pressing on the muscle, and it will now be weakening the muscles furthermore. So when it weakens the muscle, you will notice that your near reading is faulty. It's somehow, and then that can take you to the clinic and say, doctor, I can't read properly. And they will just run the normal test, because the normal routine test run in the clinic, we do pre-glaucoma screening tests, even without you knowing. Generally, that's what we do when we come to the clinic. We just run the even if you come for glasses test, we run
Check if
we check where we run that screening test for you, and you won't even know we did it. And so when we now run it and say, okay, maybe it's glasses test, we run everything, and we see that it's not glasses. I think this person is having some signs of glaucoma. You understand? So those are for the fortunate ones. Why mostly people that have the early stage of glaucoma, they don't know they have glaucoma. It's only when it is now advancing, when it's getting to the advanced stage, or rather when it has gotten to the advanced to late stage, that's why they now notice that, there's a dark shade somewhere around.
They'll be seeing
things exactly at some point, not like all the point, because glaucoma starts from the peripheral edges and closes into the center gradually. Wow. It's when it now closes it to a certain point at the center, you will now notice that there's something wrong with your vision. Wow. So at the early stage, there's actually no symptom. It's only at the advanced to late stage, people will begin to see that they are not seeing the way they are supposed to be seeing. Yes.
All right, viewers, this topic on glaucoma, we're going to go on a short break, but when we come back, we have lots of questions to answer. So stay tuned to go on a short break. All right, viewers, welcome back. We're still talking on the topic glaucoma, and she just mentioned that glaucoma cannot be detected easily, that it doesn't really show signs or it doesn't show symptoms actually. Those who are lucky they can notice that they have glaucoma, but still we're going to know how glaucoma could be prevented even if we can't identify the symptoms early. And she's going to tell us how glaucoma can be treated. So moving on to you, can you tell us how can glaucoma be prevented? Because I know that if you just mentioned that it's not something that can be identified or detected by the patient. So if you as an optometrist notice that a patient has glaucoma, how do we prevent it? How do you prevent it?
Okay, so firstly, when I see a patient and I run the normal routine test that includes the glaucoma pre-screening test, and I suspect that the patient has glaucoma. There's something called glaucoma suspect. That's when we use the ophthalmoscope. There's an equipment we use to check the nerves. That's the back of the eye. At the level of the retina, we check the nerves. There's a setting we want to see. There's a normal setting. There's something we call glaucomatous setting. So if your nerves, they are looking a little bit of that of a glaucomatous nerves, then we will tell you that we are suspecting the nerves, your eye nerves. So we need to run like a deep glaucoma screening test for you. And the glaucoma screening test, we have the central visual field test. So that checks your nerves around, both at your peripheral nerves, your central nerves. It just checks to see if there's any glaucoma locking around the corner. Then we have the optical coherence tomography test, OCT for short. So that one checks the structures of your nerves layer by layer to tell us if there's any deterioration, if there's any glaucoma. So these are the tests that we need to run, and then we'll check your pressure, your intraocular pressure. Of course, that's included in the routine test that we run, even without you asking. Yes, so we'll check for your pressure and all that. So all these things now will now give us like an idea if the patient has glaucoma, or if the patient needs to be monitored, or if the patient needs to be placed on anti-glaucoma medications. So when we have confirmed that the patient has glaucoma, even if it's early or advanced or any stage, so the first thing we need to do is that we want to place the person on anti-glaucoma medications. Yes, so there are a lot of classes of glaucoma drugs, different classes, different types. So we test the patient, we know the one that is suitable for the patient. We place the patient. So the aim of these medications is to control the drainage system. Yes, the inflow of the fluid. There's some glaucoma medication that actually reduces the inflow of those fluids. Or even dry up. Or even open up the drainage system so that the passage, exactly, to make the flow to be good. So they can be combination of both, reduce the inflow, increase the outflow, or just go and increase the outflow and lead the inflow. It depends if we'll check and see which is suitable for the patient. So this has to be done because there's some patient that even they have normal tension, like normal pressure. Their pressure is within normal range. The normal range of eye pressure is between 8 to 20. So it should not be more than 20. So there's some patients even they are having optic nerve damage. That's their nerves are getting damaged, but their pressure is normal. Even those patients, we still need to place them on those anti-glaucoma medications that will further reduce the pressure. Because like I said, it is not only pressure that is the cause of glaucoma. There are other factors that have been implicated. There's something we call perfusion pressure, system dysregulation. There are lots of things, even genetic factor, even when you are not well, your diet is not balanced, you're not getting enough vitamin generally. So, there's something we call free radicals. I don't know if you've heard that before. Free radicals, they can flow freely in our body. And they can bind to things they're not supposed to bind to. And when they do that, especially in our eye, they can go and start blocking the drainage system. They will start blocking it up. But if you have balanced vitamins and minerals in your body, you see those free radicals, your vitamins and your minerals, they will turn into what we call antioxidants. So they will go there and bind to those free radicals and mop them away from your system. So that is why even if we are treating glaucoma, we also include some vital vitamins, especially the ones that concerns with the eyes. We include them so that some people's pressure they rise as a result of lack of vitamins. So we need to include the vitamins. We need to include those medications that will reduce the pressure. And so those are the treatments of glaucoma, anti-glaucoma eye drop, and then there's gene therapy treatment, which is not so popular yet because the research is still going on. Exactly, because gene has also been implicated in the cause of glaucoma, especially for children.
Yes, those who are at risk.
Yes, especially for children. So they are proposing a gene therapy treatment, so to repair some of those things that may be making the nerve cells to die, to damage. So that's just what we do. We give them the anti-glaucoma medication. We follow them up. When some people will do glaucoma tests, even there's some early glaucoma, they will do glaucoma tests. Their results might even come out normal.
That's negative?
If one, you can call it negative. It might come out that, everything is normal, everything is fine. But then the damage will be going on gradually.
And you wouldn't be aware.
And even you won't be aware, the patient will not be aware. The result is giving you a normal result. So when you suspect a patient of having glaucoma or a suspicious disc or suspicious nerves, what you just do, you do the glaucoma test and then you do a yearly follow-up. When you do the test this year, after 1 year, you do it for the next 5 years and monitor for stability or progression. So that is the real way to diagnose glaucoma. And then when you now diagnose glaucoma that this person has glaucoma, you start giving treatment, right? Then you start monitoring. You don't just give the treatment and say go. You monitor. Even as I've had a lot of patients, I've given them anti-glaucoma medications, but their pressure they are still skyrocketing. So we need to make changes and all that. So the patient actually need to avail themselves for this appointment. When we give them an appointment, they keep to it, and everything will be fine.
All right. So going further, so what are at risks of getting glaucoma? You just mentioned earlier it could be genetic. So apart from being genetic, what other who are those who could likely have glaucoma?
Okay. So at risk, number one, Africans. So Africans, we actually predisposed to glaucoma because of the melanin, the melanin pigment on our skin. So we have a lot of that in our iris. You know what where the iris is? That brownish thing in our eye. Very good. So we have a lot of that in our eye, and the iris is part of the drainage system. So sometimes these melanin pigments, they dust off their cells around, just like drinking pure water and throwing inside the gutter. It will block our drainage system. So these iris, they dust off their pigments around, and that can actually block the drainage system. And like I said, when the drainage system is blocked, the fluid is not flowing out,
It's
pressure will
just
start
right.
rising. Exactly. So that's number one. We are Africans.
Africans.
Generally, we are all predisposed to glaucoma.
Wow.
So, are you an African? If yes, then you are predisposed
So
to
even you
glaucoma.
two are predisposed. So what recommendation will you give to our viewers who will watch you?
Okay, before I give recommendations,
Okay.
so apart from being African,
Yeah.
secondly, if you have someone in your family that has glaucoma, maybe your mom or your dad or your ancestors,
Okay.
you are predisposed to having glaucoma. Then thirdly, if you are short-sighted, we have different types of refractive errors. As error in seeing, we have hyperopia, that's long-sighted, myopia, short-sighted, and others.
Okay.
So I'm just going to talk about myopia.
Okay.
So people that have myopia, they have this long eye length. Their eye axial length.
Okay.
So it's a bit longer than normal, and this can actually delay transportation of nutrients to the optic nerves.
Oh.
So people that have myopia,
Okay.
they are predisposed to having glaucoma too.
Okay.
So those are the people that are predisposed to glaucoma.
So what recommendation and what advice do you have to give to our viewers watching at home?
Okay, I'll just say since glaucoma is an insidious disease. Insidious mean that you don't know you have it. It's a sneaky thief. Let me put it that way. It's sneaky, you know. So you don't know. You're just living your baby girl, baby boy life. You don't know anything is happening in there. So I'll just recommend that everybody, especially if you're African, do a yearly glaucoma test. Even if the first time you do it, they say, you don't have glaucoma, you can go. The following year, do it again. Just keep doing it. You're not doing it to look for glaucoma. You're just doing it to keep that health, to be healthy. So you run your routine eye test. And also if you have been diagnosed of glaucoma, it's not the end of the world. A research has it that a lot of people that has glaucoma that are following their treatment plan according to how they are supposed to follow it, they don't get blind eventually. It's only those that it was not detected on time, they were not placed on any medication, and even those that were placed on medication but they are not compliant with it, they get blind at the end of the day. So I would advise that if you have been diagnosed with glaucoma, please take your medication, follow your appointment. Okay, it's for you to see. The eye is a window to the body. Without the eye, if anything happens to your hand, you can bear. But if anything happens to your eye, I don't know how to say that. So it's just good to prevent blindness by following the recommendations, following your medications, and all that. Then eat good diet, eat the balanced diet. You can get antioxidants, eye supplements. Those things they help, especially for people that have myopia, the short-sighted people. Yes, they should form a habit of coming to the eye clinic to get the eye supplements. That's some good ones for them. Although another thing about these eye supplements, they are lipid-based. You know, we have the water-based vitamins and the lipid-based vitamins. So the water-based vitamins, the body uses what they want. They use what they want and throw away the rest that they don't want. But the lipid-based, they take what they want and store up the other one, which is dangerous. So most of all these eye supplements, they are lipid-based. So it has to be monitored by a doctor. You don't just go to the pharmacy and say, I want to buy eye vitamins because I've heard Dr. Emilia say, everybody go and take eye vitamin. No. Let your doctor give you and monitor you. Recommend, exactly. So that at the end of the day, you don't start treating one and causing another thing in your body.
Alright, viewers, that's so much we can take on this topic, glaucoma. So, as she mentioned earlier on, make sure you visit your doctor yearly. You know, there's a saying that goes, a vision loss cannot be restored. So why do you allow your vision to be lost? You want to be visually impaired? So for me, it's a no for me, because she just mentioned that glaucoma is in Africa, like it's someone with
South African disease.
South African disease actually, and it's sneaky thief. So to avoid glaucoma, visit your doctor annually. Not just your doctor, your optometrist. So this is me, Irene Okechukwu, your host on Health 247, and
Dr. Emilia Iyezia.
Alright, it's a pleasure having you in this program. So thank you very much, viewers, for sitting back to watch us. See you on our next episode on Health 247. Bye-bye.